Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
I'm Dr. Bradley.
I'm Mike Heffernan.
Mike Heffernan.
Cardiologist. You've seen him on our other videos. Does an awesome job, and apparently all our viewers love you, so thank you.
Yes.
Welcome.
Today we're talking about life after heart attack, life after MI. So you've had an MI, or someone you know has had an MI, a heart attack. What now? Do you just walk it off, back to normal life, back to what you were doing before? What's life look like after you've had this major cardiac event?
Walk it off. I like that.
Shake it off?
We definitely don't say that.
No.
So people are understandably worried after a heart attack. It's a life-changing event.
Yeah.
And so you've had a heart attack, and we have about, I guess, really three things that we can do after you've had a heart attack. Number one are pills. So there are some medications that we can use to help prevent a future heart attack, or at least reduce your risk, not 100% prevention.
Our viewers love pills.
Yep.
Pill for every ill. That's what our viewers say.
Fantastic. Next is sometimes there's a blocked artery or two, and we can do an angioplasty. So we can open up that blocked artery first with a balloon, and then we put a little wire stent in there called a stent.
Okay.
And then finally, if you have lots of blockages, we can't just stick with pills. We can't do an angioplasty. Some people need bypass surgery.
Right.
So those are the three usual options after having
Is
a
it
heart
ever a
attack.
case where you just, you've had the heart attack and there's nothing that we have to do? You know, that part of the myocardium has just gone, or there's nothing we can do to help you now. The part that was diseased has had its effect, and there's no intervention that we require from either surgical point of view?
Yep.
Okay,
Yep.
so not everyone who has a heart attack needs a surgical intervention after.
No, surgical or
angioplasty.
or an angioplasty, which is
Right.
for the cardiologist. Yeah.
Would you say most? Like what percentage are we talking? So take 100 people that have heart attacks.
Yep.
How many people need an invasive procedure?
So everyone gets an invasive procedure. You know, virtually
Diagnosis.
everybody gets an angiogram
Yeah.
for the
Yes,
diagnosis.
sorry. Yeah, invasive treatments, right?
Because we need
rather
map.
than diagnosis.
Yeah.
Yes.
So about 20% of people don't need anything
Okay.
other than medications.
Okay, so then everyone who has a heart attack, would you say, is going to be on some kind of medication after?
For sure.
Okay,
Yeah.
there you go.
And we can talk, I guess, briefly about those. So one would be something to thin the blood, typically.
Yep.
A host
And-
of different medications.
Yep, and so usually it's a combination of aspirin
Yep.
plus another medication called ticagrelor.
Okay.
For some people in some countries that might be clopidogrel.
Okay.
So those two medications usually, it varies, but at least for a year, they're going to be on the combination.
Yep.
Aspirin usually forever.
Working mostly on your platelets.
Yep.
Yep,
So
okay.
the platelets are less sticky, will kind of go through any blockages or whatever's been fixed.
Okay.
And the point of these interventions, be it pharmacologic or interventional,
Yep.
is to minimize the chance of another event.
Correct.
Minimize chance of having another heart attack.
That's right. So, and remembering that over the course of 3 years, 15% of people will have another event.
Okay.
So that's not a small number.
No, one in six or so, one in seven?
Yeah, over the course of 3 years. So using some of these therapies that are tried and true and proven, we know we can reduce that
Okay.
risk.
So we've got some medical interventions, pharmacologic and interventional procedures. How about lifestyle? Are there certain lifestyle changes that are recommended?
Yep. And so 4 weeks after people have had an event like this, we enroll them in a cardiac rehab program.
Okay.
So lots of centers around the world will have access to some programs like this. So it's a structured exercise program to talk about lifestyle in particular, from often physiotherapists and nurses with an expertise in the field to really give people some comfort,
Yep.
some reassurance, and some guidance
Okay.
over the course of the next 3 or 6 months, going, okay, here's how we can optimize things. So regular exercise being one, healthy weight another, good nutrition,
Right.
good diet. Doesn't have to be a diet,
Right.
but just a healthy diet.
Yep.
Smoking cessation. So if you were a smoker, we need you to really stop. We know it's hard to stop, but there are some mechanisms and tools we can use. And alcohol consumption,
Right.
which is a bit of a hot
topic.
topic right now.
Topic.
As-
And that's to stop alcohol or to start drinking alcohol?
So not to start drinking
Okay.
it.
There's literally
Cessation.
nothing that says now's the time to start drinking.
No.
It's a good time to have a
No,
drink after
so-
all that.
Yeah. So no, it's a what would be a healthy alcohol consumption, Remembering the World Health Organization says there is no safe amount of alcohol,
Right.
and the
Zero.
Canadian guidelines have gone down to about 2 a week.
2 a week,
okay.
Big drop from previous.
For sure.
Okay, so sorry, go ahead.
I was just saying a question about the exercise because I'm sure some people are like, listen, I'm motivated. I'm a type A kind of person. I want to run half marathon. Like,
Yep.
do the therapists help guide the intensity, the duration, that kind of stuff, or is it
Absolutely.
really based on how you feel?
No, it's
Okay.
guided that way. And,
Yep.
and really, it's actually with heart rate monitoring.
Okay.
So we like people to not push it to 100% of what is their age predicted heart rate,
Right.
the max. We like them to sit at 70, 75%
Okay.
for a period of time until they're better. I think the other important part, you talk about exercise, is some people, they're competitive athletes
Yes.
or recreational athletes, and they want to go back to playing baseball with their buddies in the summer or playing soccer with their friends in the fall, that sort of thing, and hockey. They will be able to go back to this kind of stuff.
Amazing.
Yeah, so it's just a matter of not yet.
Yep.
Let's just make sure we cool things off and make sure you're safe.
I was
Okay.
going to say on the lifestyle modification and healthy living, I think it's important not to feel guilty or we're not assigning blame when we say, hey, it's time to adopt this lifestyle or this eating habit. It's not saying what you were doing before caused the heart attack. There's a lot of factors, genetics, lots of different factors that go into it.
Yep.
But now that you've had the event, this is the appropriate lifestyle that can minimize the chance of having another event down the road.
No question. I think one of the throwaway lines that I use commonly in the coronary intensive care unit, a day or two after something like this has happened, people are understandably, they look like a deer caught in the headlights.
Yeah.
You want to reassure them and say just what you've said. And most often I'm able to say, it's a little ironic, but a year from now when I see you, you're going to tell me this was probably the best thing that could have happened because so many things have changed and they often are better a year later.
How often do you see these events happen where people essentially had no symptoms, where rather than having a little bit of chest pain and then more chest pain over weeks and months, whereas I was normal and then all of a sudden, bam, I had the event.
That's almost all the time.
Right? That's typical. So you're not alone if this is how it happened to you.
Yeah, absolutely. Because you've got a 34 or 40% narrowing in your coronary artery. You can't feel that. It's not bad enough to block flow. We're going to have a big snowstorm later today. It's going to happen. So later this afternoon, we'll have a couple heart attacks come rolling in, which is sad, but it'll happen. So somebody that doesn't exercise very much is about to go out and shovel half a foot or a foot of snow this afternoon, and all of a sudden that 30 to 40% plaque, which is perfectly fine this morning while they're drinking their coffee, is going to rupture and crack.
Right.
And as soon as it ruptures and crack, your body thinks you've just cut yourself, and it does what it's supposed to do. When you cut yourself, it forms a clot, and it forms a clot in a small little artery, and that's the heart attack.
Right.
So in terms of screening, I mean, we have a lot of technology, a lot of fancy imaging, a lot of ways to make a diagnosis. What's the screening program? Is there any screening program for heart disease?
There are. So there are a variety of tests. You can do a plain old exercise treadmill, and we run people on a treadmill. We do an ECG while it's happening. That will pick up. So it will most often pick up things. About 70 to 80% of the time. So recognizing it's a treadmill, it's an ECG, pretty simple setup. We can do some more sophisticated things, so we can do that whole treadmill setup, but we can also image the heart with an ultrasound at the same time. So at peak exercise, we can look at all the walls and go, look, are you behaving? Is everyone moving the way they're supposed to? So we can do that, which is non-invasive, no radiation. The flip side is we can also do nuclear imaging. These are all from the outside without us putting anything inside you to have a look. And then finally, for people that we're a little bit more worried, we can do a virtual angiogram. So we can do a CAT scan of the heart and recreate the coronary arteries and get a really good idea whether somebody's got a significant blockage there that would make us want to do the next step and kind of go inside and look. And that's before they've had a heart attack, for instance.
And that's just a regular CT scan?
A regular CT scan with the appropriate software. But behind all of that is a radiologist with the expertise in order to be able to read it. You need skills.
Okay, that's cool.
Okay, now who gets this work of it? Do you have to have symptoms? Do you pass a certain age? Do you have a family history of it? Like, let's say one of our viewers is like, boy, I think I need that. How do I go about getting that? And do I have to meet a certain criteria before I qualify for one of these investigations?
So symptoms for sure.
Okay, if you have symptoms, go see your doctor and you can get set up for one of these diagnostic investigations.
Yep. If you have if you're about to start a competitive sport,
Okay.
or if you mentioned doing a marathon,
Right.
not really done that before, you're about to start a training program, reasonable to do a screening stress test to make sure that you're safe. A concerning family history, to be sure. Members of your family having premature heart disease, men less than 55, women less than 65, you're concerned about your own health, screening tests are absolutely fine. Those are good starts.
Okay. Heavy snowfall on the horizon.
Yeah.
One last thing about a life after a heart attack. We talked about it before we started filming. Just the psychological impact of having a heart attack. This is very real. So if you're at home and you've had a heart attack, and you're like, my life feels totally different, and I'm nervous or I'm depressed. This is very real and very normal. And Mike's going to talk about that.
Up to 50% of people will have some feeling of depression after an event like this, and it's understandable. You've had a brush with death.
Yeah.
You can sense your mortality, at events like this.
Not gonna lie, I'm a little sad just from this video. I'm just sharing, Brad.
Sharing
Sharing
and
is
talking
caring.
about it's good.
Yeah,
good.
it's scary.
Absolutely. So we need to be supportive in that, and we recognize how you're feeling, and we also know that you see a cardiologist at 4 weeks.
Yeah.
You don't see us again for about six months.
Right. So you kind of let go, and they're like,
We let go. We rely on the family doctor, the primary care physician, to kind of pick up the ball and roll with some things. Again, at 12 months, and depending on your center, we don't generally fire patients from our practice. They kind of stay with us forever if they've had an event like this.
Right.
But in some regions in the world, even some regions in Canada just down the road, after a year, discharged from the practice back to primary care. So it may really vary how long you're attached to your cardiologist. If you're in my practice, you're stuck with me forever.
Okay.
So that's generally the path. And during all those visits, we're really looking at the big things. Is your blood pressure well managed? Is your cholesterol well treated? If you have diabetes, is it well managed?
Right.
And then always talking about the lifestyle stuff to make sure that you're kind of attending to all of that.
Okay. So talk to someone. If you have those feelings, talk to someone. Talk to your family doctor. Talk to your family, and get the help that you need.
Wow, that was a great summary of life after heart attack. Life goes on after heart attack. It's changed a little bit, but changed for the better, it sounds like.
100%.
In terms of the interventions and the lifestyle changes. And we hope this video makes you feel a bit better if you or someone you know has had that situation.
Thanks, Dr. Heffernan, for joining us. If you like this video, please like it, subscribe to our channel.
And leave us some comments. Tell us your stories. I think other people who are in a similar situation find it helpful to read some of the comments that our viewers leave, helping them see, well, I'm not the only one who this happened to. So thanks. And you are in charge of your own health.
We'll see you next time.